Upbeat, yet serious and informative intro music fades into the background. Hello everyone, and welcome back to the channel. Today, we're discussing a topic that is incredibly important for all of us, lung cancer. Now, I know that can sound scary, but knowledge is power. The more we know, the better we can protect ourselves and our loved ones. Early detection can literally save lives, and that's why today, we're going to walk through the common symptoms of lung cancer and, just as importantly, the practical steps we can all take to help prevent it. So grab a cup of tea, get comfortable, and let's dive into this crucial conversation. First, let's talk about the signs. What should you be looking out for? It's important to remember that these symptoms can be caused by many other conditions, but if they persist, it's always best to get checked out by a doctor. The first and most common symptom is a persistent cough. We all get coughs from colds or the flu, but we're talking about a cough that just doesn't go away. It might linger for weeks or even months, and you might notice it getting worse over time. It could change from a dry cough to one that produces mucus, or the sound of your cough might change. If you have a smoker's cough, pay close attention to any changes in it. A new, chronic cough is a red flag that your body is trying to tell you something. Don't just dismiss it as a minor annoyance. Next up is chest pain. This isn't just any minor ache. The chest pain associated with lung cancer often feels dull, deep, and persistent. It can be made worse by simple actions like taking a deep breath, laughing, or coughing. The pain might be concentrated in one specific area, or it could feel more widespread across your chest, shoulder, or even your back. This happens when a tumor presses on nerves or other structures in the chest, or if it spreads to the lining of the lungs, called the pleura. If you're experiencing chest pain that doesn't have a clear cause and won't go away, it's time to talk to a healthcare professional. Another key symptom is shortness of breath. You might find yourself getting winded from activities that used to be easy, like climbing a flight of stairs, carrying groceries, or even just walking across a room. This is known as dyspnea. It can happen if a tumor is blocking a major airway, or if fluid has built up in the chest, a condition called a pleural effusion, which prevents your lungs from fully expanding. Feeling constantly out of breath or easily tired during your daily routine is a significant sign that your respiratory system isn't functioning as it should. Perhaps one of the most alarming symptoms is coughing up blood. The medical term for this is hemoptysis. Even if it's just a small amount, a few streaks of red or pink in the phlegm or sputum you cough up, it should never be ignored. While it can be caused by other less serious issues, like a severe chest infection, it's a classic warning sign for lung cancer. Seeing blood is a clear and urgent signal to seek medical attention immediately. Don't wait to see if it happens again. Next, we have unexplained weight loss and a loss of appetite. If you find the numbers on the scale dropping without you trying to lose weight, it's a cause for concern. You might lose interest in food or feel full after eating only a small amount. This can happen because the cancer cells use up a lot of the body's energy. Also, the body can produce substances that change the way it processes food, leading to muscle and fat loss. If you've lost 10 pounds or more without changing your diet or exercise habits, it's a symptom that needs to be investigated. Another subtle but important sign is hoarseness. You might notice your voice becoming raspy, deeper, or strained, and it doesn't get better after a few days. This can occur if a tumor is pressing on the recurrent laryngeal nerve, which controls the muscles of your voice box, or larynx. If people start commenting that your voice sounds different, or if you find it difficult to speak clearly for an extended period, it's worth getting your throat and chest checked out. Frequent chest infections are another red flag. If you seem to be constantly battling bronchitis or pneumonia, and these infections keep coming back, it could be a sign of an underlying problem. A tumor can block an airway, making it easier for bacteria to grow and cause infections in that part of the lung. So if your doctor is repeatedly prescribing antibiotics for chest infections, it might be time to ask if there could be something more going on. Finally, there's a general feeling of fatigue. This isn't just feeling a bit tired after a long day. This is a profound, persistent exhaustion that isn't relieved by rest or sleep. It can be overwhelming and interfere with your ability to perform daily tasks. This fatigue is related to the body's response to the cancer, the energy the cancer cells consume, and other related symptoms like poor nutrition or shortness of breath. If you feel bone tired all the time for no apparent reason, listen to your body. Okay, so we've covered the symptoms. Now, let's shift gears to the most empowering part of this discussion: prevention. There are so many things we can do in our daily lives to significantly lower our risk of developing lung cancer. The single most important step you can take is to not smoke. Smoking tobacco is the #1 cause of lung cancer, responsible for the vast majority of cases. If you don't smoke, don't start, and if you do smoke, please know that it's never too late to quit. Your lungs begin to heal the moment you stop. There are countless resources available to help you, from nicotine replacement therapies to support groups and counseling. Quitting is hard, but it's the best gift you can give your lungs. It's also crucial to avoid secondhand smoke, as breathing in someone else's smoke also increases your risk. Second, avoid exposure to carcinogens. This is particularly important if you work in an industry like construction, mining, or manufacturing. Be aware of harmful substances like asbestos, arsenic, diesel exhaust, and silicate dust. Your employer should provide protective equipment, like masks and respirators, and ensure proper ventilation. Always follow safety protocols to the letter. Your long-term health depends on it. Third, test your home for radon. Radon is a naturally occurring radioactive gas that is invisible, odorless, and tasteless. It can seep into homes from the ground and is the second leading cause of lung cancer, and the leading cause among non-smokers. You can buy an inexpensive radon test kit online or at a hardware store. If the levels in your home are high, you can have a radon mitigation system installed to vent the gas safely outside. It's a simple test that could save your life. Fourth, focus on a healthy diet. While there's no single food that can prevent cancer, a diet rich in fruits and vegetables is packed with vitamins, minerals, and antioxidants that help protect your body's cells from damage. Try to eat a rainbow of colors. Think leafy greens, bright red berries, oranges, and deep purple eggplants. A balanced diet supports your overall immune system, which is your body's first line of defense. Fifth, get regular exercise. Physical activity is a powerhouse for your health. It strengthens your heart and lungs, improves circulation, helps maintain a healthy weight, and boosts your immune system. You don't have to run a marathon. Aim for at least 30 minutes of moderate activity, like brisk walking, cycling, or swimming, most days of the week. Find something you enjoy and make it a consistent part of your routine. Sixth, talk to your doctor about regular checkups and screenings. This is especially important if you are at high risk. For instance, if you have a long history of smoking or a family history of lung cancer. Your doctor might recommend a low-dose computed tomography scan or a low-dose CT scan. This screening can detect lung cancer at its earliest, most treatable stages, often before any symptoms even appear. Be your own health advocate and start that conversation. Finally, try to minimize your exposure to air pollution. While this can be challenging depending on where you live, you can take small steps. Pay attention to air quality reports, and on days when pollution is high, try to limit your time spent outdoors, especially strenuous exercise. Using air purifiers in your home can also help improve the quality of the air you breathe every day. Remember, your health is your greatest asset. Being aware of these symptoms and proactive about prevention can make all the difference. Early detection of lung cancer dramatically improves the chances of successful treatment. Don't ignore persistent symptoms and don't be afraid to talk to your doctor. You know your body best. Thank you so much for taking the time to watch this important video. I hope you found this information helpful and empowering. If you did, please give this video a thumbs up. and share it with your friends and family. The more people who know this information, the better. And don't forget to hit that subscribe button and ring the bell so you won't miss any of our future videos on health and wellness. Stay healthy, stay informed, and take care of yourselves. See you in the next one.